Wimbledon is well and truly on its way, and it's probably the best time of the year that us Brits can get our fix of tennis. Let's look at some of the common injuries that may occur from tennis. So, like with a lot of sports, you'll look at things like ankle injuries, so like rolled ankles, twisted knees. Tennis sounds great. Lower back can sometimes take a bit of a brunt force, and of course, obviously, we know the history around Andy Murray, or some of it, Andy Murray's hip, and the force through that. But there is one injury that gets its nickname realistically from the sport: tennis elbow. So what is it? So you don't ever have to pick up a racket in order to get tennis elbow. In fact, a lot of desk-based workers tend to get it. Most of the time it's because their wrists are up too high, or maybe the wrists in that sense are too low, fingers are up too high. And if I wiggle my fingers, you can see that all of these lovely juicy muscles fire at an incredible rate. So it's usually a lot of the time, it'll be the backhand in tennis, especially if you're right-handed. It'll be the backhand in tennis, and it's that action of the wrist extension and repetitive that then leads to tennis elbow. Now, I'm telling you all this, and you're probably thinking, well, I've got tennis elbow at the minute. How do I solve it? If you're getting quite a bit of pain, especially very, very local to the outside of the forearm here, if it might be tennis elbow, it could be something more complex, so it's always good to get it assessed. But if perchance it is tennis elbow, you can grab a trusty tennis ball and you can work into that area whilst you're wiggling your fingers at the same time, and that might be enough to help it. It might not solve it, but it might be enough to help it. Enjoy Wimbledon.